Joe Chili, boarding 7 to 9 on Buffalo's oldie station, the Big Wack. Joining us on the Big Wack's Buffalo on the Rise today is Dr. Christian Milioto from Western New York Pain Relief. Doc, how are you?
Good. How are you?
I'm doing very well. Doing very well. You know, we want to talk about some of the things that affect people, spinal pain and chronic spinal pain. Do you get a lot of people that come in with pain that's chronic and, you know, affecting their back or knees or elbows, shoulders, whatever?
Every single person that comes into my clinic
Really?
has been dealing with chronic pain. They've tried everything under the sun to treat it, and they've had little to no success until they've stepped through our doors.
How does it feel to be like the last resort? You get
I
that
mean,
sometimes?
in all honesty, I have 75% of my patients that come in to the office tell me that I am their last resort. And, you know, I feel good about it because I know that that person is in a safe place. I know that that person is going to receive care that they've never had before. And I know that we're going to help give them their life back, and we're going to significantly reduce their pain and help their damaged nerves heal. So I'm confident, you know, I'm very confident, but I do feel for that patient because they've suffered for a very long time.
Why do you feel that traditional treatments fail?
So I don't think all traditional treatments fail. I think that when a person has a problem from a disc or a nerve or arthritis that becomes chronic, that's the problem with the situation. So usually what happens is somebody injures their back or their joint, they have sciatica or stenosis, or maybe they develop a condition called neuropathy, where they're feeling numbness, burning, or tingling in their legs and feet. Well, generally the first thing people do is they go and they see their primary care physician, who will assess them and then refer them for imaging or to a specialist. And then people kind of get stuck in this trap where, you know, they go and try physical therapy, it doesn't work. They go see a chiropractor, they do acupuncture, they do massage, none of that's working. Then they see a neurosurgeon, they don't want back surgery, so they do a spinal injection or they're put on pain medication, and they kind of get stuck in this snowball effect where the person's declining and their symptoms are getting worse and they're not getting better. So I think that's the biggest thing is a lot of times when we work with somebody, we look at everything they have going on. How long have you had it? Have you had back surgery? What type of neuropathy is it? Is it diabetes? Is it circulation? Did you have chemo or radiation therapy? And our therapies are regenerative forms of medicine that are effective, FDA approved, they have immediate results, and we're reducing and eliminating medication and surgical intervention. So I think, you know, it's kind of how our system of medicine is, and people have to be an advocate for themselves. You have to seek the proper care, do the research, ask the right questions, and then that's how you can get the results you're looking for.
When you talk about neuropathy, how does somebody know if they're suffering from neuropathy? Is it like a cell phone, you know, vibrating on you? Is it a larger thing than that? Or?
So it could be many different things, and that's the problem with neuropathy. Neuropathy by definition means the person feels numbness, burning, or tingling in their hands, legs, or feet, okay? But neuropathy can come from type 2 diabetes. Mm-hmm. It can come from people who have unknown spinal conditions or spinal conditions that go left untreated and don't heal properly. People with circulatory problems, and then individuals who are on certain types of medication or have undergone chemo or radiation therapy for cancer treatment. The important thing about neuropathy is two things. When you go and you see a neurologist and they diagnose you with neuropathy, no medication that they're going to give you treats neuropathy. They tell you it's for pain, they tell you it's for the nerve. I'm not sounding angry about it, but I feel for my patients. I have a lot of compassion and love for them. And I want them to understand that if you're taking gabapentin, it's an anti-seizure medication. It's not for nerve damage. If you're taking Lyrica or Cymbalta, you're taking medication for people that are clinically depressed. So all these things affect the brain. They're not affecting the neuropathy. There are treatments that can regenerate damaged nerves. There are treatments that can eliminate neuropathy. That's what we do.
All right, describe for me, we have about 3 minutes left. Describe regenerative evidence-based medicine.
So we use a combination of treatments that work on all of the damage resulting from somebody's clinical condition. So we work on the blood supply, the disc, the joint, the nerve, the balance issues that they're having, strengthening the individual, and most of our patients are 60 to 90 years old, and they're people that couldn't stand or walk. One of my favorite patients we just finished with, Marlene, is 86 years old and went to the second last Bills home opener, was able to walk up and down 50 steps to the Bills Stadium, left us a review online saying, I walked down those stairs, I walked up, no cane, no pain. If you are in pain, give these guys a chance. And that's what makes me feel good.
That's incredible. Now, what type of patients are we talking about? Just briefly give us what kind of, is it back pain? Is it leg pain? Is it,
Arthritis, inflammation, sciatica, stenosis, bulges, herniations, neuropathy, weakness or heaviness in the legs and feet, instability, chronic inflammation, and circulatory disorders.
And you're not talking medicine. You're not talking about, having to live off pain pills or, Advil or ibuprofen or whatever the case may be,
No,
right?
not at all. Our therapies are non-invasive, no medication. We treat patients no longer than 20 to 24 visits to get the healing effect that they need. It doesn't matter if you've had multiple back surgeries. It doesn't matter if you've had pain for 25 years. My patient Biagio has severe stenosis, couldn't stand or walk when we met him, couldn't feel his feet. 3 weeks of care, 6 treatments. He can feel his feet again. He can stand and walk again. He's not using a cane or a walker. That's how quickly these nerves can heal, and people have to understand that they have to give themselves a chance.
All right, how can people schedule an evaluation with you?
Call 650-7246, go to buffalopainrelief.com. There you can watch our TV show, you can fill out our pain questionnaire, you can come to my seminar and my open house and learn how you can help get your life back.
All right, Dr. Christian Milioto, Western New York Pain Relief, thank you.
Pleasure as always.
For more information and answers to your questions, contact Western New York Pain Relief by calling 716-650-PAIN or go to WNYPainRelief.com. Sponsorship and promotional consideration for the preceding segment was provided by Western New York Pain Relief. And don't forget to join me weekday morning 7 to 9 a.m. on Buffalo's oldie station, The Big Wag.